we can no longer ignore that somebody's health outcomes are going to be worse if they are Black or brown than if they're white. We say, okay, so we're going to focus on equity, but we're not exactly going to say what we mean by that and who's doing that and how's doing that and what does that actually look like. We're talking about issues that are really impact people's lives in profound ways. And so, okay, we're talking about addiction and alcoholism and mental health, and we sit at a table and nobody says, is there anybody at the table that has this life experience?
Hey friends, welcome back to Public Health Careers. Today I have the pleasure of chatting with Jennifer McKeever. Jennifer is the founder and managing director at WE Public Health, a collective of public health consultants who are co-creating a more equitable world. She is someone that does not want to stand out, but rather she is someone who stands with others. She conferred a bachelor's in Spanish language at the University of Houston and a dual master's in Masters of International Public Health at Tulane University, as well as a Masters of Social Work at Tulane University. In today's episode, you'll hear and learn more about how and what inspired Jennifer to create WE Public Health, a collective of public health consultants, the benefits of doing a dual master degree in social work and public health, and how she navigated and progressed in a growing startup nonprofit and how that increased her skill sets in public health, and much, much more. Be sure to hit that subscribe button and leave a review. Enjoy today's episode.
Hey, this is Jennifer McKeever, and I'm a public health entrepreneur, and you're listening to Public Health Careers.
Jennifer, I am so glad to have you on today. I've heard many things, and you've come up in many conversations that we've had here on the podcast and in the public health realm, generally speaking. So I'm excited to learn more about your journey and how you got into public health and all the work that you're currently doing with WE Public Health.
I look forward to the conversation.
Awesome. So before we jump into anything, how do you identify, and tell us a little about your personal background?
Yeah, sure. So I am a white female. I use she, her, hers pronouns. I am originally from Houston, Texas. I have spent a good portion of my career in New Orleans, and I am currently in Washington, D.C., where I've been for about 15 years. Although I'm experimenting a little bit with a digital nomad lifestyle, and so I'm also spending time in other places as well, sometimes visiting my family in Houston, sometimes exploring other parts of the world and figuring out what it's like to try to work from a laptop in different countries.
And how's that experimentation going for you, just generally speaking?
It's good. It is good, but it's also, it's a little bit lonely at times. And so I think I have a real travel bug. I love to explore, and I feel like it really wakens my senses when I'm in a new culture and a new language. But if I'm going on my own and doing a lot of work, I find, oh gosh, okay, this can be a little isolating. So I have to figure out kind of what is that balance of getting to fulfill the travel bug and work and not find myself, completely isolated.
Yeah, absolutely. I'm just glad that you mentioned that, because I feel like it is something that people are thinking about more, and just knowing that people in public health can do it in so many ways, as well as so I'm glad that you're able to do that. And what if you can name maybe your favorite place that you've been to, or a place that you're excited to go to, what would those be?
Well, for my whole life, or or as working digitally. The first thing that comes to my mind is Italy. So about a year and a half ago, I went to Italy and stayed in a few different places in central Italy and then around Lake Como, and I just loved it. I just felt so happy while I was there, and the challenge with work was the time zone difference, but it was still manageable as long as I was willing to work at night and sometimes till midnight, which I was. I'm not sure where next is going to take me other than to visit family in Houston. We'll see where the next big adventure might be.
Well, that sounds exciting, and I hope that you're able to have some safe travels. I will actually be going to Italy and to Lake Como later this year for a wedding, so very, very
Oh, I'm
excited for that.
jealous. I'm jealous. Have you been before?
I have been to Italy, but I've not been to Lake Como before.
It is magical.
Okay, well, I'm looking forward to all the magical vibes. Awesome, awesome. And I might ask some more questions about digital nomad life a little bit later on.
Sure.
But shifting us a little bit, and we'll talk more about the business that you started, WE Public Health. But before, and I think like just to ground us in some of the important concepts in WE Public Health is like, I just want to understand, why is it so important to co-create to ensure that we have a more equitable world?
Yeah, I think so for me, when I think about co-creation, I think about community and partnership and finding solutions together rather than for. And, so throughout my career, I've been in environments where we have the folks who have the education, myself included, specific professional experience, and there is an identified health problem, and we're going to go fix that health problem with the data and the evidence that we have, right? And often we'll bring that to communities and populations, and we haven't even asked them what the problem is, right? And so it's that kind of paternalistic, exclusionary approach that I think is something I've just like seen repeatedly over the 20 plus years that I've been in the field. And so co-creation has become really the center of my focus in all my work. And it's a recognition that through co-creating and everybody having a voice and everybody's ideas kind of contributing to other ideas, it's a little humbling to recognize that it's just that solutions are going to be better. So I have maybe one idea, but the reality is my idea is built on the ideas of everybody I talk to. And it just gets reshaped a little bit. And then I talk to another person and learn from them, and it gets reshaped. And so there's sort of this like art of collaboration and recognizing that nothing happens in a vacuum. And I've just found that to be a real driving force and motivation for me, is to do work in partnership.
I appreciate you raising up the fact that the paternalistic system, the system just generally saying, okay, this is the issue that this community has, let's give them this solution, without actually giving a meaningful voice to the community, just creates the issue within itself. Because if you're talking about, I don't know, substance misuse, but the community is concerned about affordable housing, then there's a mismatch in where they see where the resources are, where the needs are, where the impact is, and like to the point of course we have expertise, and the expertise is valued, but it's never valuable unless it's like aligned with that community expertise, with that lived experience. Like to your point, all the ideas that we have are built off of the ideas that we've had from our experiences and from the interactions that we've had. And then people that are most impacted by the issues, many times the issues that we are trying to work with community to solve, have very different lived experiences, and they can give us a very different perspective. And I think like that's going back to the importance of like that collaboration and ensuring that there is the community voice in that work.
Yeah, and that it's driven by, that there's no solving a problem for somebody. And are you even asking what is the problem and can I help you with this or not? And so that's just been a theme that I've seen come up like repeatedly. It's even in like the increased use of community health workers to do pieces of work very early in my career, where we use the term peer educators. And there was this sense that like, wait a minute, they don't they don't have the education that we do to understand whatever theory of, whatever it is that we're trying to accomplish. And yet that person was often, if not always, just more poised to have meaningful impact in their community.
Yeah, it really goes to show that like we need humble solutions mixed with expertise to get to realistic goals. And like one of the things that I always talk about is the systems have been created because the people that are at the tables created those systems. And if we don't give voice, space, new tables to people who have not been a part of those conversations, then we end up in the same position that we are in today. So definitely a huge advocate for that. We will get to how and maybe like why you decided to get your Masters of Social Work and your Masters of Public Health at the same time. But I want to ask you, like, now looking back on that decision, what has been the benefit of having the dual degree?
Yeah, for me, it's been immeasurable. When I went to school, there were only at the time, I think there were like 6 or 8 dual degree programs, and I chose to go to Tulane University in New Orleans, and they called themselves a dual program, but the truth was I was taking social work classes at the uptown campus and public health classes at the downtown campus, and I was having to figure out the different schedules. So in a lot of ways, it felt like doing, 2 separate degrees at one time. I feel like social work gave me an understanding and appreciation of community-driven work, and the some of the ideas that we're talking about here is like really partnering with and working with communities. I think it gave me a sense of group dynamics and how groups work together and function together, and how to navigate different cultures and backgrounds and sort of facilitate some meaningful conversations among different groups. And then the public health side of my education really gave me an understanding of how do you create a program, implement a program, evaluate a program, and then a little bit more about the science of epidemiology and surveillance, and those sorts of things. So it felt, I've said this to people before, that it felt a little bit like a heart and mind kind of combination, where social work was the heart and public health was the mind.
Well, I appreciate you sharing that, and I think that gives a good foundation for like the benefit of both and how it can really frame how we do the work, how we show up in the work, how we um, work with communities, work with groups, or implement programs. And there's a whole host of things in there. So looking
Mm-hmm.
forward to digging deeper into why that decision come up in a little bit. But before we get to that, let us figure out, what does public health mean to you?
I think it means thriving thriving people in thriving communities and a thriving society. And it's not just the physical health, it's not just the mental health, it's the sort of whole spectrum of well-being and ability to thrive. And I think if I say too much further, too much more, uh, my potentially slightly socialist tendencies might come out. But it's that is the world for me, where everybody's kind of got that opportunity. And maybe there's in public health a sense of part of what fuels that for me is justice. And so I think you can't have good public health without justice.
Before we get back to the show, are you passionate about public health and looking to elevate your career, brand, and impact? Join the public health community today. Gain exclusive access to career-boosting events, connect with like-minded professionals, and stay ahead with the latest trends in public health. Plus, enjoy mentorship and career support to help you thrive. You'll even learn tips and tricks on how I grew my LinkedIn by 2,000 followers in the last 6 weeks. Sign up before the end of May to lock in your membership at the current rate before prices go up. Don't miss out on this opportunity to grow and connect. Join us at thephmillennial.com/join or in the link in the description and be part of our vibrant community dedicated to making a difference in public health. Let's build a stronger future together. Now back to the show. So you got your bachelor's in Spanish language at the University of Houston. Tell us the thought process of going into undergrad.
Well, I don't know how much I was thinking. When I went to college, I guess my family environment that was just something that we did. So that's kind of the background that I came from, is that the kids, you grow up, you go to college, and then you get a job. And so that was just kind of a thing that I was doing. So I didn't have to work hard for it. I didn't have to make a lot of decisions about it. And so when I entered college, I didn't really know. I did pretty terribly. I ended up on academic probation after my first year. And I eventually, so I don't know what I was majoring in, but I was taking a number of different courses. And then I actually met a woman in my dorm who was from Spain, and she spoke like 3 languages. And I thought that was just really cool. And so I took a Spanish class and I was pretty good at it. And so then I took a French class and I was pretty good at it. And so I actually, I majored in Spanish and minored in French. I got the opportunity to study abroad in both those, in Spain and France. So I was really, really fortunate for that. And I think, looking back, it was just a matter of exploring and find something that I liked and was good at. And I kept doing it. And it's something that I, still use and get to practice today.
Absolutely. Exposure is the beginning of so many different things. So tell us about those study abroad experiences.
Yeah, I spent 2 semesters in the southern part of Spain in Seville, and it was really challenging, sort of reflecting back on that. It was an amazing experience, and it's probably the best way to learn a language. All of our professors, nobody spoke English, so you just, it's kind of sink or swim. You're going to have to figure it out. But it was, it was just also challenging. I was young, and I'm not sure I had the maturity level that I could have had in that experience, but it's good, and it's probably what, sparked the travel bug for me. And then the other program I did was just a summer program, and it was wonderful. And in all ways, I actually met the first love of my life there. So I don't know if that didn't really give me any college credits, but that was a bonus.
That is a bonus. That is a bonus indeed. But I'm glad that you're able to get those experiences and really, I think it sounds like it was something that's very important to you and important in the person that you're becoming, being the digital nomad that you are today. So I think and I feel the experience of traveling and being in a different place, different culture is just a leading experience that can teach us so much about life and so much about how we can operate and move in life. So were there any undergrad takeaways that you wanted to share with us?
Just about what, from going through the undergraduate process. I think just that everybody is probably kind of figuring out what they're doing. And it can feel pressureful, and maybe like if you're in college, like you're supposed to know what you want to do and choose that one career path and go down that one career path, but it's really just an opportunity to explore all kinds of interests. And so maybe not feel too pressured by, one specific career path.
Yeah, absolutely. Like there's so much life and opportunity out there. We have no idea, and anyone that tells you that they haven't figured out, they're probably lying to you. So, so after your bachelor's degree, you pursued the dual Master's International Public Health and Master of Social Work at Tulane University. Tell us, what was that thought process? Did you know about social work, public health? How
Yeah.
did all those come up?
Yeah. No, I didn't know about either. So I knew I liked Spanish and languages in general, but I didn't really want to be a teacher. I didn't want to be an interpreter. And quite frankly, I was in Texas, so I was never going to be the most proficient Spanish speaker who was available. And so I had always sort of had a sense that I wanted to do something that was helping people, but I didn't know what those careers were. And I actually applied for jobs in human resources at organizations because I thought I want to be a resource to humans. So let's see how I can do it. And then I learned what human resources really is all about. And it wasn't what I thought. So, I had a few years of I worked at a facility for adults living with who were developmentally delayed, and they were in semi-independent living. I did that for a while, and then I actually I got an opportunity to go volunteer in Honduras for a year. And so I was in Honduras, outside of the capital there, at an orphanage where there were, at the time, over 500 kids who were living on this ranch. And I volunteered there for a year, and that's where I got exposure to public health. It's funny now that I think about it, I'm realizing that the one woman in my dorm taught me about Spanish language, and this other woman, and also my dorm, but in Honduras, taught me about public health. And so her father was in public health, and she kind of introduced the topic to me. I don't remember how I learned about social work, but I ended up actually studying for and taking the GRE while I was still in Honduras, and then ended up going to school after that.
What was the decision behind? Well, firstly, very cool. I'm glad that you were able to like be in that space and get like once again exposure to public health. So what was the thought process of going for the dual degree?
I don't remember specifically, but I think it was probably that sense of, when I learned about social work, it was the most closely aligned with my idea of what, being in a helping profession could look like.
Mm-hmm.
And I also, I started with public health. I did have a focus on international health. And so I really did imagine that one day I would work in like international health, which didn't come to be. So I think it was likely just, again, my friend's influence, and then somehow I learned about social work, and then somehow I discovered, oh, you can do these at the same time, that led me to go for those two together.
Understandable. And what was that process like doing the dual degree? How did you balance that? Did you have any internships or any experiences that really shaped what you wanted to do afterwards?
Yeah. Yeah. So I mentioned earlier that even though it was billed as a dual degree program, in a lot of ways, it felt like I was just doing programs side by side. There were a couple of courses that, if I took this course in public health, it counted for that course in social work, but not many. And so it was pretty intense. It was 2 years, and I was taking classes in 2 campuses. I was taking classes almost on every break and like throughout the summer. So there would be intense courses offered during the 1-month Christmas time break, for example, or a night course. So it was, now that I think about it was a lot. In my social work course, a full year of the classwork is actually an internship. So we had to do, I think it was 3 days a week for a year of an internship, and I worked at a nonprofit organization for women and children living with HIV. And they provided social work and social services. And my early career was with people with HIV. And so I'd say that really influenced, the career direction that I chose early in my career.
Well, I'm sorry that the dual program wasn't as dual as it can be, but it sounded like you were able to navigate that as well as the internship. That's awesome. That an entire internship is like based in the class, like to get you out in the community to really do it. And I feel like that is what we need more of, so you can actually bridge that gap between theory and practice and really get that hands-on experience.
Yeah, you are absolutely right. It was vital.
Did you have any other takeaways that you wanted to share with us from your dual degree experience?
On a practical level, I'm not sure I understood the debt situation that I was taking on. And I don't know if I would do it differently, having to do it over again, but it was definitely a realization that, oh, okay, this is something that I'm really going to have to take forward with me in my life. And so I would, just offer as advice that people really consider that, because as we know, it's a burden for a lot of people.
Yeah, well, thank you for raising that up. And yeah, there's no time more important than now to be more intentional in making that choice, making the investment, like really being thoughtful in making whatever decision that is, whether that's an MPH, a bachelor's degree, a master's of social work, because yeah, there is a lot of potential risk, or just a lot more things you have to consider. So I appreciate you raising that.
I will also say that I know that there was a sense that it was important what school you go to, right? Like it's one of the best schools in the country, or that it has some title. And I don't think that's ever really come up. Like nobody has ever said to me since then, oh, you went to Tulane. Well, that's better than having gone to University of Texas or anywhere else. No dig on University of Texas. I'm sure it's a great school. So that's something that, if I had taken a moment to like look at the prices side by side, I might have considered that.
That's actually very, very real. And just understanding that whether you're going to one school or another, if you just be proactive in whatever you want to get out of the career, whether that's internship, mentorship, meeting with certain people, like you have to be the one that's taking the driver's seat in that. Because when you really think about it, if you go to a school like Harvard, you are probably unlikely to be the smartest person in the room. But when you go to another school, you can more likely than not be the smartest person in the room, be the person that's more proactive in all the different ways, and really show up to be that person in the school. So yeah, there's definitely a balancing act, and I'm never someone that just goes towards big name schools, but that's just me. And anyway. So after you graduated, you were the director of social services at Belle, Reve, New Orleans. Tell us about that.
So that was my first job out of graduate school. You're pronouncing it correctly, but they pronounced it incorrectly, so we called it Belle Reve. Okay. It was a residential facility for people living with HIV. It had started as really a hospice type facility for people living with HIV to spend their, the end of life and have a peaceful death in this facility. At the time that I went there, it was a real shift in there was starting to be like more medications for people with HIV, helping them live longer. And so the environment was somewhat different in that we were doing more work with people, helping them to manage HIV and provide a lot of social services and case management. And so that was, helping people, get benefits if they needed to get benefits, get transportation to the doctor, get any other social support services they need, and that sort of thing.
Okay, that's awesome, and I'm glad that I pronounced it correctly. As I was reading it, I was like, "Is it French?" And I'm like pronouncing it incorrectly, but that was not the case.
It is French, but we pronounced it incorrectly.
You live and you learn. You live and you learn. And then after that position, you were program supervisor and program manager at the Louisiana Office of Public Health.
That's right. So that was, somewhat of a step in my career, in that I went from an agency that was directly providing services to people living with HIV to a funding organization. So the State Department of Health provided funding to organizations around the country, around the state of Louisiana that were doing HIV services. And so I provided support and oversaw funding to agencies around Louisiana that were doing different types of HIV work, whether it's housing support, medication support, food bank, transportation, all kinds of social services and medical services.
And what did it take to shift in that type of role in the position that you were doing?
It was a really nice job in that I still was able to be on the ground, so to speak. So I would get to travel around to these agencies and meet with their clients and interact with their clients, and then also see kind of how administratively things work. I think a shift for me there was probably getting a closer look at governmental bureaucracy and how that can create some roadblocks to the work that we're trying to do and make some things inefficient. So that was a real learning curve for me, and just understanding how to navigate bureaucracy.
Yeah, you are not the first one to say that, and I imagine that you will not be the last one.
Sadly, no.
Right, is one of the inherent challenges in governmental public health.
Yep.
And after that role, you became Director of Public Health Practice and Training at the National Network of Public Health Institutes.
The first job I had at the National Network of Public Health Institutes was as a program manager, and then I worked there for 14 years, and so was promoted and took on different responsibility throughout those 14 years that I worked there. But this was the focus of my work in all of the different jobs and titles that I held at that organization was really on the governmental public health system and helping build capacity of organizations and workforce. And so that looked a lot like, providing training opportunities or learning community opportunities, or facilitating like long-term cohort-based learning programs, and working with a number of national partner organizations and health departments to do just a really wide variety of activities, but all with the target of strengthening our governmental public health system and the workforce that's doing the work.
And what were some of the main capacity needs that those organizations needed?
Yeah, maybe flip the question to what wasn't needed, because it was a lot, and I think it really depends. We were talking about bureaucracy, and so I think that has been a big part of the work that we did, was really helping people kind of navigate those systems to, not so much early on, but I'd say later, to more equitably do the work that they're doing. And so, for example, that could be You want to give money, you have money, and you want to contract with community-based organizations to do work. Yet your process for those organizations to apply is just way too difficult. And your requirements once they're funded are way too difficult, but all those things are put in place for a reason, right? They're put in place so that we can be accountable for how the money's spent. And so figuring out how to navigate some of those obstacles that are put in place for accountability. And so I think there was really, I guess, I would say we really focused a lot on, less so on like disease specific work, or, like building your capacity to do surveillance, or building your capacity to, do outbreak investigations, and more about how are you, what skills and capacities do you need to run a highly effective organization that is a partner with their community to improve health. So the needs were vast. And then add on top of that, all health departments are understaffed. And then you've got the situation we were in when COVID hit.
Right. Understaffed, no infrastructure, lack of plans, no federal structure for public health to initiate plans. So
underpaid,
underpaid, underappreciated.
Yes.
Well.
Yeah.
Sorry, a lot in there.
Yeah.
And so you said you were at this organization for 14 years. Tell us, or give, if someone wanted to work in an organization, a national organization like National Network of Public Health Institutes or another national organization, what kind of advice would you give them to have a career that has longevity, has impact, has progression, as you were program manager and then shifted all the way, got promoted all the way to director of public health practice and training?
I don't know if I have specific advice, because the truth is, when I started at that organization, I was like the third or fourth employee. And then it has grown to, I don't know how many employees they have today, but it's a lot. And so the opportunities weren't there, but they continued to be created as the organization grew, right? And then I was able to step into additional roles and take on more responsibility and get some level of promotion. But even in that environment, there were still people that felt like there's not an opportunity for me to advance here. And so it's hard to say, I don't feel like there was any special skill or strategy that I was able to figure out that helped me stay in that career and move up that organization. It just honestly was circumstantial, and I happened to have some skills that were needed at certain times.
Yeah, I would not discount the fact that you were one of the first hires as well, which I think says something for an organization wanting to say, hey, we're building this new organization. They like, look at these hires, and that's awesome that you were able to grow as the organization grew. And I feel like there's two sides to that. Maybe it's like, yes, that can happen, but then there's also the potential for you to be at a new organization and then it doesn't grow, or like those opportunities don't come there. So really, I guess, weigh out the opportunities. But I'd also imagine being in a early start organization, you just gain so much experience because you probably have your hands in so many different things.
Yeah, that's absolutely true, and I am really grateful for that that opportunity. And so even, that is, and I guess if I'm thinking about it, advice is, what are there are advancement in terms of title and pay and status of a position, but there's also opportunities. And if you are in a position with a smaller organization and having to do more, that gives you a really good opportunity to figure out how to do stuff that you might not otherwise do in a more sophisticated organization where you're like really narrowly focused on one thing. So go find a startup. That'd be my advice.
No, it makes sense. So like sometimes just take on roles where they're asking for like various responsibilities where you're really able to build out those various skill sets because you never know which one is going to be the skill set that really helps you get into that
Yeah,
next position.
yeah, yeah.
So you are founder and managing director at WE Public Health. I would love to know, when did the thought of WE Public Health come up, and like what was that process in getting it started?
Yeah, well, it's still coming up, 3.5 years into it. After 14 years, I reached a point where I started to feel some sort of like cognitive disconnect between what I was seeing and feeling and hearing in our work. And so, especially what I mean by that is like we were talking about some real issues that we couldn't ignore any longer. We can no longer ignore that somebody's health outcomes are going to be worse if they are Black or brown than if they're white. So we say, okay, so we're going to like focus on equity, but we're not exactly going to say what we mean by that and who's doing that and how's doing that and what does that actually look like. We're talking about issues that are really impact people's lives in profound ways. And so, okay, we're talking about addiction and alcoholism and mental health. And we sit at a table and nobody says, is there anybody at the table that has this life experience? What can we learn from you? How can we figure out how the people here are actually part of the community that's experiencing some of these issues? And so it felt just like academic and disconnected in a way that was not working for me. And so I actually, when I left, it was June of 2020. So the COVID-19 pandemic had just started. George Floyd had recently been murdered, and there I was without a job. And so I said publicly, I'm taking a personal sabbatical, but privately, what that meant was I need a minute, and I need to figure out what am I going to do with myself here. And the truth was, I already knew what I wanted to do, and I just hadn't had the courage yet to say that out loud. And that is to try to create a collective of women consultants in particular who are working in public health. And the idea, I said earlier, like no idea is really mine, and this is true too. My job had afforded me a lot of contacts around the country, so I just knew a lot of people and had the opportunity to work with a lot of people. So I started, talking to people and saying, hey, why did you become a consultant? And what do you like about it? What do you not like about it? What advice would you give me? And I did kind of an inadvertent qualitative study where I started to hear themes that were coming up. And so some of those themes were people that were working independently. They had chosen that path because they felt like they'd reached kind of, an end of the road in their jobs, whether that was glass ceiling, whether that was, experiencing racism or other types of depression, oppression, and maybe depression because of that. And just not feeling a sense of being able to like move forward and have their voice heard and valued at a table. Others talked about really wanting to be able to kind of do things on their own terms and have some freedoms to set their own schedule and be able to meet other obligations like caring for children or parents or other family members. And so the people that were doing this kind of consulting independent work liked a lot about it. but really missed being part of a team and feeling like collectively they were able to make a big impact. And at this time, I think a lot of people were feeling like, how can I actually do something that's going to be meaningful and impactful? And so I was able to convene about 10 women that I knew that were doing this to go through kind of a visioning process to say, what is this WE Public Health thing and what can it be and who do we want to be and how do we want to be? And so we created our organizational values. We created, kind of the culture that we wanted to have, how we want to work with each other and with other people, the type of work we want to do, and how we want to go about that. And so it was, sort of visioning what this collective of consultants could be. And then we did it.
Well, yes, y'all have been doing it. That is for sure. And I've definitely been seeing a lot of the WE consultants pop up here and there on LinkedIn and everywhere. So you shared that you went into your personal sabbatical and you knew what you wanted to do, but you didn't have the courage to share it. What changed?
I think what changed is, that I left that job and was in a situation where, I had an opportunity to decide what's next. And that is either I can go forward and, apply for and try to find other jobs, or I can try to create this thing with colleagues together. I guess it was a little bit of a sense of maybe a little now or never. And if not now, when? And ... all of that. I also have to say I had a lot of, all of these women that I had talked to were uplifting me in a way. And so it may not be that I actually had the courage. It may be that I had the support to help me take those next steps.
I love that. I also love the fact that you said you were doing a needs assessment ahead of time. Well, really,
It's accidental.
really just having conversations, assessing, realizing that there are themes, that there is something here, and then in doing so, have that first convening, build out organization. What did that initial push as a collective look like?
Yeah. So, I think our original ideas were around how can we have a greater impact together. So, me, myself, and I am probably not going to apply for a $15 million grant and get it and make a big change, but maybe me, myself, and I and other people coming together and figuring out how our strengths align could go after this grant and have a bigger impact. So that was a lot of our focus at first was, how do we set up a process by which we are individual, entrepreneurs with our own business, but collectively we're doing work together. So that's what we focused on at first. And to be honest, we got really, we got a little tripped up in some of the details of like operationalizing that. So how do you decide, what funding you're going to apply for? How do you decide who actually gets the work when it comes in? Are you going to decide by seniority or level of experience? How are you going to decide, what rates people are paid? Are they going to be paid this based on seniority or that based on, less experience? And we were going to kind of spin out on those details. And so we had to say, you know what, we don't know. We're going to start experimenting and we're going to talk about how those experiments are going. And by that, I mean, we were just going to go after work and start trying to do it and learn from it and document it and like say, what did we do right? What did we do wrong? How are we going to do it better next time? And on and on and on and learn from that process. And so I'd say that's really what we've been doing since then. I think it was, well, I've lost all track of time, but a year and a half ago, maybe, we actually just put one post on LinkedIn that said, we are interested in, any consultants who might be interested in partnering on possible work. And I was overwhelmed by the number of people we heard from. And so I've had conversations with everybody that's reached out to us, and I was consistently amazed by the talent of people that I was speaking with. And, there's both people like me that are maybe more senior in their careers that are just sort of fed up. And so they're going on their own and working on their own because they're fed up. And then there's lots of younger people that are like, I'm not even going that way. I'm going my own way, and I'm starting my own business, and here's how. And I'm like, wow, if I certainly wouldn't have done that at the same, point in my career. It's pretty exciting, actually. And so we've got now, I think, 40 consultants, and there's probably 30 who are like not on a waiting list, but who I just haven't had the opportunity to talk with now. I see like this community that you have with Public Health Millennial, and there are lots of other kind of member groups and communities popping up. So people are really like getting together and helping each other out and figuring out how to do this whole career thing, which is really exciting to me. But anyway, I've lost the thread of your question.
No, you are on the thread completely. I love it because there's no cut and dry playbook or toolbox for the work that you're doing. I love that you came in and said there are all these things that are bogging us down. Let's do it and let's figure it out and let's go from there and let's share the experiments that we're doing with the group and then really be open about that. And yes, I've seen so much need or like just consultants wanting to come together. And like to your point, it's like there are opportunities out there, but oftentimes it's not something that you can do by yourself. But in the collaborative, there is power in that. And really thinking how do we come together to utilize those skills. And I've been to the website. Many of the faces are very familiar to me. Some of them have been on this podcast already or will be on the podcast. Yep. So definitely see the amazing things that you're doing and bringing together amazing people in public health to do this kind of work. If someone was interested, I know that you said you have a wait list. Are there any like criteria that y'all are looking for in consultants, or what's the best way for someone to think about thinking about joining WE Public Health?
Yep. So on our website, there's the page is who we are, and under there's a little link to join us. And we welcome anybody there's an interest form that can be filled out. We welcome anybody to fill out that form and express their interest in being, engaging in WE Public Health. We will reach out to you immediately, but it may then be a little bit of time until we can kind of talk to you and bring folks into the collective. Right now, there are 3 requirements to be part of the collective. One of them is to share 2 business opportunities per year. That can look a lot of different ways. It can be as simple as forwarding a request for proposal. It can be, more official, like a consultant that says, I have this work, but I can't do it myself. I need help, and let's do it together. Participating in a couple of calls. We have 2 calls every month that are like the WE business calls. We call them our office hours because we are really building this together. Everybody that is a part of this has a voice in all decisions that we're making. And so we have those. And then the third criteria is being willing to give 16 hours of volunteer time. to the collective each year. And we don't prescribe what that looks like. We hope that collaborators will bring their own ideas of like what's the special sauce that they have that they think would benefit the full collective. I will say transparently that those are the requirements right now, and that is what we are moving forward with throughout this year. But we are also seeing such an increased interest that we're trying to assess how to manage that interest and what to do with that interest, because the larger we get, it changes the dynamic a little bit. Yet there's this need of people wanting to network and really connect with each other. So we are going through some processes now to try to decide, how we want to try to have lift up that desire for connection that people have, while also keeping these opportunities to do work together.
And are there any other challenges that came up as you and everyone else were building WE Public Health?
No, it's been smooth sailing, not a problem at all. I mean, it's mostly been a pleasure, to be honest with you. I have probably been more like excited and motivated about my career now than I ever have been. And it's because I feel like there's such potential and so many great people working in public health. The challenges, they've been kind of small stuff like, I've never run a business before, so I guess I have to learn how to do that, right? So learning just all of these things that are new to me, and getting things up and running, having enough time, which is everybody's problem, right? So I'd say that the challenges are pretty simple and straightforward, and then the rewards are just much, much bigger. I feel really grateful that the people who are a part of it are really committed to, really have and feel ownership in building what this can become. I had one of the experiences in my my previous job that I think has played in here for me was that, although I didn't see it like this at the time, this was so, I said I left my previous job in June of 2020. And so in the weeks after George Floyd was murdered, we had, I don't remember specifically what week, but it was probably the week after that had happened. And we had all staff meetings every Monday. And they're usually like these very quick staff meetings. We do 30 minutes and then everybody is out. And we were about to end the meeting. And I said, what are we going to do? Are we going to talk about this and what happened and what it means for us as an organization and our staff? And the call ended up going like 2 hours, and people were talking, people were sharing, and we ended by saying, do y'all want to talk again? And the answer was yes, we do. And I think what that highlighted for me was the power that I hold and the position that I hold in certain spaces and rooms that maybe I didn't even recognize I had, and how I can use that to help lift up other voices. And so I think of, maybe it's just me, but I think that like WE Public Health can be an opportunity to bring work to really talented people who would not otherwise have access to that work. And so that's, I think part of the focus as well. So again, I've lost the thread, but
I'm loving the narrative, and I definitely think, as you say, in a lot of the barriers were the small, simple, just figuring out how to do these things and just like doing it, which is always something. Like when we're doing something new, it is all those learning lessons, all the learning curves to actually just be able to be proficient at the thing.
Yeah.
And I look forward to seeing where We Public Health grows and where you'll continue to do great work, because I definitely think there is a need for that space and for the support and community and the work that y'all are doing.
Yeah, thank you. I'm glad I got to be on your podcast. I really appreciate it.
Yeah, it is truly my pleasure. And wanted to tie it back to earlier part in the conversation when we were talking about digital nomad life.
Oh,
Because I'd imagine that kind of came up while you also transitioned into being founder and managing director of We Public Health. And I had like just talking back to many people, many younger people, like the idea of living a digital nomad life, like the idea of potentially consulting and just working more on their time. And those are the kind of attributes I think many, maybe not all, people are kind of leading towards. So what was that step for you in taking that jump into digital nomad life?
I kind of had an advance. I was an early adopter because when I moved to Washington, D.C. in 2008, and I was the only staff person for my organization that was in D.C. Everybody else was in New Orleans. And so we were doing video calls back then. And people were annoyed with me, but I was always like, I need to see your face, get on the call with me. And, we would use Skype and such. And so I actually was lucky enough to have a boss that let me go and spend some time in France. And I rented out my apartment in DC, and then I went and spent some time in France. And she was like, I don't know if this is going to work. This is making me really nervous. I mean, this was probably like 2011-ish.
Mm.
And because of the technology, I pulled it off, but people just weren't really comfortable with it. And so anyway, I kind of got to do it. So I got a little bit of an early taste of like, here's like the technology you need to have in place, and here's how you need to like make it work. So it wasn't, I mean, I guess I had an early opportunity, so it hasn't been too much of a shift for me.
And if anyone was asking you advice on navigating digital nomad life, what kind of tips would you give them?
Make sure your technology is working so that you can be available in all the ways that you would be if you were local. So people don't, feel an absence that you're not right near them. I would say a lot of video communication if you can with clients, again, to have that connection. And willingness to work at weird hours.
There you have it. But thank you for sharing that. And before I move you on to the Furious Five, I would love to know, where can people connect with you, and where would you like to see yourself in the future?
Well, people can connect with me through LinkedIn is probably the best way, or on our website there is a contact us button, and if you click on that button, the email will actually come straight to me. So I will see that as well. And I think, in the future, my hope is that We Public Health will go on beyond me. And so right now I'm the managing director because somebody has to be. But I really don't want to have that role forever. I want the organization to continue and grow. So that's my focus for the future.
Well, we look forward to seeing that happen.
Me too.
Awesome. So moving you on to the Furious Five, the 5 questions I ask all guests.
Okay.
Number 1, what advice would you give to a student trying to pursue a career in public health?
Test out different options. The field is vast, and if you go to a school that is focused a lot on science, That might not be for you. If you go to a school that's more focused on the social aspects, that might not be for you. But there's lots of opportunities.
Number 2, if you are talking to someone wanting to get into your position, what advice would you give them?
Talk to other people who have done it and take good notes.
Number 3, what's something you're working on improving in your life right now?
Decision making. Because I always know that somebody else has got a good idea or there's additional pieces of information that can help inform the work. That means sometimes I take a little too long to make decisions. So I'm working on improving my decision making.
Number 4, professionally, do you recommend anything?
This podcast. I'm actually just about to start reading a book I've heard of a million times, but never read myself. It's called Boundary Spanning Leadership. And it talks about how we have to be able to work with different people of different skills, technology, social skills, and work across all of these different people toward a common goal.
Love it. I'll have to add it to my book list. And then number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
You'll get there. Your path is going to be windy and maybe a little bit different, but that's going to end up being your strength and not your weakness.
Definitely a strength, and I appreciate you coming on today, Jennifer, and sharing your story, sharing your journey, sharing how you're building WE Public Health and really doing this work.
Yeah, thank you so much.
Yeah, the pleasure is mine. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you've made it this far and leave a review and share it with a friend. I greatly, greatly appreciate that. I will see you all next week.